Hi, my name is Alexia Sawyer, and today I'll be giving my Symposium 7 speech. The movement to decriminalize psilocybin began in the late 2010s, with Denver, Colorado becoming the first city to decriminalize psilocybin in May of 2019. The cities of Oakland and Santa Cruz, California followed suit and decriminalized psilocybin in June 2019 and January 2020, respectively. Psychedelic-assisted therapy has the potential to help heal trauma, but individual therapy alone cannot solve the systematic issues that often cause these traumas. This also requires advocating for comprehensive harm and risk reduction, including honest and culturally relevant drug education, legal and accessible substance analysis, peer support, and accessible services for mental health and integration. It is believed that healing is intertwined with justice, and that social and political and cultural progressiveness creates fertile ground for community healing. In this speech, I will talk about how not legalizing the use of psychedelics can be harmful, why legalization of such drugs opens a door for misuse and overdosing, and what benefits the legalization has for those who have suffered from trauma. Not legalizing the use of psychedelics can be harmful. On January 17, 2016, Vox.com wrote an article about Charles Grob, a UCLA professor of psychiatry and pediatrics who studies psychedelics. He conducted a study that gave psilocybin to late-stage cancer patients. Quoted, "The reports I got back from the subjects, from their partners, and from their families were very positive, that the experience was of great value, and that it helped them regain a sense of purpose and a sense of meaning to their life. The quality of their lives notably improved." On May 15, 2021, Bloomberg Opinion stated, "A striking new study published in Nature Medicine argued that MDMA-assisted psychotherapy represents a potential breakthrough treatment for post-traumatic stress disorder." APA.org agrees with this statement and wrote on July 31, 2017, "Antidepressants that affect the balance of serotonergic and noradrenergic neurotransmission, or which alter serotonin neurotransmissions through other mechanisms of action, are also helpful to PTSD. But a common side effect of antidepressants is thoughts of self-harm and suicide, whereas these psychedelics have not shown any signs of wanting to commit these acts." There are many uses for psychedelics that would be lost if they were kept illegal, but there are many side effects that people say are less desirable with their legalization, and that there is huge stigma behind these types of drugs. Legalization of such drugs opens doors for misuse and overdosing. According to OceanRecoveryCenter.com, if the government taxed and legalized drug markets heavily, drug gangs could still operate. This could involve producing or smuggling the substances and selling to consumers at lower prices, or selling stronger versions. Progressive.org on December 31, 2020 states, "The medical model also lends itself to exploitation by pharmaceutical companies. Psilocybin mushrooms, for example, can be found in nature and grown at home, but the medicine model puts these medicines behind a paywall with artificial limits on supply." Mindcure.com on May 4, 2021 writes, "Rather than being promoted for their therapeutic potential, psychedelics like LSD, psilocybin, DMT, and mescaline took on negative associations due in part by messages from anarchy and protest. Psychedelic drugs became largely connected to insanity, self-harm, and rebellious attitudes against war and police. These factors did not play well for psychedelics, regardless of the suggested effects on cancer, addiction, depression, anxiety, and trauma. There is a huge stigma behind these drugs that is caused by the media portrayal of these psychedelics rather than the medical standpoint. If people were to know the medical benefits to using these drugs, that idea might change. Many people fear that the legalizations of these psychedelics could lead to addiction and an easily accessible market to those who gain no benefit. But there are many pros to the use of these drugs, and it has been proven that these psychedelics can help with cancer, stress, trauma, PTSD, and even cancer. So, how does legalization of this drug have benefits to those who have suffered from these traumas or illnesses, and how can we control the access and potential harm? Well, Medical News Today wrote on June 29, 2021, that a 2016 study of 29 people with cancer who had anxiety or depression related to their diagnosis compared to those who got a single dose of psilocybin mushrooms to those who got a placebo. The psilocybin reduced cancer-related anxiety, hopelessness, and dread immediately after the dose. At 6.5 months, 60 to 80% of the psilocybin group continued to report improvements in depression and anxiety. January 17, 2016, Vox writes, "If pulled off correctly, this would maximize the best possible outcomes and minimize the worst. Supervisors could prevent addiction, and they could walk people through good and bad trips, letting users relax and get something meaningful out of the experience. There are risks to be controlled in these settings. If a supervisor is poorly trained or malicious, it could lead to a horrific trip that could actually worsen someone's mental state. This is why regulation and licensing will be crucial to getting this idea right." In this speech, I discussed how not legalizing the use of psychedelics can be harmful, why legalization of such drugs open doors for misuse and overdosing, and what benefits the legalization has for those who have suffered from trauma. Psychedelic-assisted therapy has the potential to help heal trauma, but individual therapy alone cannot solve the systematic issues that often cause these traumas. This also requires advocating for comprehensive harm and risk reduction, including honest and culturally relevant drug education, legal and accessible substance analysis, peer support, and accessible services for mental health and integration. It is believed that healing is intertwined with justice, and that social, political, and cultural progressiveness creates fertile ground for community healing. There are so many benefits to the legalization of psychedelics, and there are states who have already dabbled in the research to allow these drugs to be used safely and properly, and it has worked. The more we research, the better the results.